Prof, a very good morning to you once again. So lots of concern from your side as well about what's happening, the impact of lockdown when it comes to testing for other opportunistic diseases. And we're looking at cryptococcal meningitis associated with HIV, for example.
Yes, that's right. So one of the key tests to identify individuals that are infected or have opportunistic infections is the so-called CRAG test. And this is really important in individuals that have a poor immune response as a result of long-term infection that has never been diagnosed and managed. And in South Africa, despite having a fairly large and successful program, there are people who still present late for testing, and they already are susceptible to cryptococcal meningitis. So part of the programs that have been instituted in South Africa over the last few years is to identify those individuals with a poor immune response, and that is looking at a CD4 count, and then place them on treatment. So what we've seen with the lockdown, in fact, as we've seen for TB and other healthcare utilization services, is actually a decline in the number of persons that have presented and tested for cryptococcus.
And that's what we're seeing on the graph currently on screen. So what are the dangers, what are the fears here then, Prof, about what's going to happen as we continue to focus on COVID-19 and as the lockdown continues to impact here?
So my fear is that the reasons for people not being tested are either because of the initial lockdown, which was the stage 5, where there was severe physical restraint on people moving, and or that people did not have the ability to access care and treatment either through transport or at the particular facility. So my concern is, and I'm sure it's not just my concern, is that there are individuals out there who could be readily ill and need attention and are not seeking that particular attention. So there may well be people who were severely ill and actually made that effort because they were ill, but there are still individuals that are out there who are ill, not seeking attention, and need that attention. And we won't really know that because if they don't present, the statistics will be reflected elsewhere, but we won't know that it's a result of the cryptococcal antigenemia.
If you had to venture a guess, Prof, what would you say is the reason for this, of people not going out? Is it fear of going to a medical facility? What would it be that would be causing this decline?
Yeah, I think it's a combination of things. I think it's really around the fact that there was that physical restraint from the early stages. In fact, some of that is still there in terms of accessing, say, public transport. It's also in the rural areas, again, where people, again, may not have sufficient funds to obtain the transport that they need. And it may well be the fact that there's a level of fear of going to facilities that are treating patients with COVID, for example. So there could be multiple factors as to why people are not seeking the care that they do.
And, you know, the thing is, and just to take you back to when, yes, we weren't seeing such a decline when people were going out and getting these tests. The question is, how would they know? Because now the fear would be, if I'm feeling terribly ill, could it be that I have coronavirus or, you know, whatever that is? Is there probably that kind of mix-up at the moment as well? Because when we didn't have corona, people might have gone to say, I'm not feeling too great. You know, if I am HIV positive, I need to have my checkups done regularly. And now they just don't know what it is, or maybe they're afraid to find out. I don't know.
Absolutely. So, again, it's what we've been talking about very often on your program is really about communication. So it's really key that the departments of health at the different levels are communicating to our communities, saying our services are available. If you're unwell or you know that you're feeling unwell, please make use of our services. It's there. You're going to be safe when you walk into our facilities, whether it be a hospital or clinic. We are there to serve you, and please make use of our services.
All right, we'll leave it there for now. Thanks very much. Just delving into other issues when it comes to us dealing with COVID-19 and the pandemic. We should not be ignoring other illnesses.